Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today, I want to provide the latest numbers and remind us all about the importance of staying safe this holiday weekend. I am pleased to report that there have been no new deaths in the last 24 hours. Almost 12,800 Albertans have now recovered from the virus. However, we identified 164 new cases of COVID-19 yesterday, and the provincial lab completed 10,709 more tests. Currently, there are 1,433 active cases in Alberta. 47 people are in the hospital, including 9 in intensive care. We are heading into the last long weekend of summer, and I know many people are excited to enjoy it. However, the number of cases being reported today is a clear reminder that we cannot afford to be reckless. COVID-19 does not take holidays, and we have seen weekend barbecues and other gatherings spark outbreaks in the past. I want to encourage all Albertans to have fun while making safety a priority this weekend. Relax, enjoy yourself, but remain vigilant. There are many ways to have fun while still doing it safely. For example, I know our province has many beautiful places to visit on a hopefully warm and inviting Labor Day weekend. If you do visit new places, make sure you're aware of any additional restrictions, such as mandatory mask bylaws, that may be in effect where you're going. Most places we go, we will share with others, so bring a mask and hand sanitizer and plan backup activities if you find yourself in a crowded or unsafe place. Gas pumps, store doors, and shop shelves are high contact areas. If you stop, sanitize your hands before and after pumping gas, shopping, and paying for and taking food at a drive-thru. Wear a mask in indoor spaces where you might not be able to maintain distance at all times. After using a public bathroom, wash your hands for at least 20 seconds and sanitize again after touching the door on your way out. In most cases, being outdoors makes it easier to maintain physical distancing. For those who are camping this weekend, remember that campground operators have COVID-19 protection measures in place, so please follow each campground's guidelines. Alberta Parks is encouraging visitors to bring a mask and wear it when around people who are outside your household, and to bring hand sanitizer. Accommodation providers in communities across the province are ready to welcome us with cleaned and sanitized rooms. Still, be aware of your surroundings and wear a mask if you're in common areas where you can't keep distant from others. Currently, close contacts are the largest source of exposure of active cases, ahead of both outbreaks and unknown exposures. It's important to be cautious even when we're with those we love. If you're attending a barbecue or other social gathering this weekend, keep it as small as possible and stay within your own cohort. Protect loved ones by encouraging everyone to bring their own food and drinks and use their own utensils. Also, please don't pass around snacks, drinks, smokes, tokes, or vapes. This isn't being rude. It's being considerate of others. Now is not the time for sharing anything that has been in your mouth. We know that the risk of transmission is lower when outdoors, so stay outside as much as possible and try to keep your distance from others. Lastly, if you're feeling even a little sick this weekend, stay home. I know it's disappointing, but don't risk passing the virus on to friends and loved ones. It has been a long pandemic, and I know how energizing it can be to go camping, check out a restaurant, have a barbecue, and spend time with loved ones. Just be wise, be safe, and let's all look out for each other. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from...
Sorry, we lost you, operator. Could you try that again?
Our first question comes from Dylan Short of the Edmonton Journal. Your line is open.
Hi, Dr. Hinshaw. I've been receiving notes from individuals who are waiting for their test results. They're saying they're waiting 5-6 days sometimes for results. This is both asymptomatic and symptomatic tests. I was wondering if this is the timeline that Alberta Health hopes for. I know that before there was like 2 or 3 days. Why is there maybe a longer delay now?
That is one of the key issues I've spoken about in the last couple of weeks, is that we have seen timelines that unfortunately are longer than we would like them to be. We are working very closely with the lab, and people at the lab are working incredibly hard, and I just want to take a moment to acknowledge those who are working on the front line in our labs, moving through tens of thousands of samples every day. But unfortunately, we have had a bit of a backlog in the last couple of weeks, and so it is taking longer than would be ideal. We are working very hard to get that turnaround time shortened as quickly as possible, and we recognize the challenges it poses as people are waiting for a test. So please know that we're aware of this issue. We're working very hard to make it shorter, and in the meantime, we ask that anyone who does have symptoms, that they please stay home and away from others while they're waiting for the result of their test.
Operator, can you put through the next caller, please?
Our next question comes from Michael King of Global News. Your line is open.
Hi, Dr. Hinshaw. Dr. Henry out in BC recently talked about how 1 meter distance is good enough if you're in school, if you're at work, places where you know the people. Is that something that you're also kind of looking at? Is going from the 2 meter to 1 meter depending on how often you see other people?
We are looking at the evidence around different levels of distancing, and that is something that we will be discussing at a special advisory committee call. Those are the committee calls where my counterparts, the other chief medical officers of health across the country, where we come together and discuss the evidence and policy implications. So we are discussing that. What we know is that 1 meter does offer protection over no distancing, and that increasing the distance adds layers of protection. We also know that depending on the circumstances, depending on the length of time someone is in the same space, depending on airflow, depending on how sick a person is, if they're coughing and sneezing, even 2 meters in some instances may not be sufficient. So we have to pick the number that we think serves the best purpose for the most people, and we are looking at that. But again, right now, what I would recommend is that people do continue to observe the 2 meters wherever possible. Where that's not possible, to wear a mask. And with respect to students in classrooms, again, we have allowed that break while they're seated and able to maintain as much distancing as possible for the specific purpose of supporting their learning and educational experience.
Operator, could you put through the next question, please?
Our next question comes from Terry Reith of CBC. Your line is open.
Thank you very much, and good afternoon, Dr. Hinshaw. Can you please update us on the status of Alberta's efforts to switch from the AB Trace Together app to the federal COVID Alert app, and what lessons have been learned from this experience that didn't quite go as planned?
We are working with the federal government on the details of how the federal app can be rolled out in the province. I don't have a specific timeline on when that will be complete, but that work is underway. With respect to the AB Trace Together app, I think one of the key lessons we've learned is that we launched the app quite early because we know that contact tracing and rapid contact tracing is a really key metric and a key measure to prevent COVID spread. What we had anticipated based on our discussions with the companies, particularly the challenge that we had with Apple devices, we had anticipated being able to move quite quickly into a fix for the problem of having the app only work while phones were open and with the app at the forefront. And unfortunately, we didn't anticipate the delay that we have experienced. So I think one of the lessons learned is ultimately that we make the plans based on our knowledge and experience at the time, and we have to continually adjust based on evolving information and the evolving context.
Operator, can you put through the next question, please?
Our next question comes from Kevin Minnick of CTV. Your line is open.
Hi, Dr. Hinshaw. Can you please provide an update on the outbreak at the DropIn Center in Calgary? And do you believe the number of sick people might actually be higher than what's been reported to public health officials?
At the moment, the drop-in center in Calgary has 6 cases. And the question of whether or not the number of ill people might be higher, there is testing underway. So all those who were close contacts, all those who were within that shelter environment are being offered testing. And so I believe that local public health, working with the shelter and the operator, are doing everything that we need to do to quickly identify any additional cases, because we are not waiting for symptom reports, but we are offering testing to all of those individuals, even if they aren't reporting symptoms. So there may well be more cases identified as we complete that asymptomatic testing. But at the moment, I do think that the control measures and the really incredible work that the operator of that shelter and Alberta Health Services that they have done over the past couple of weeks, 1 week or so since this was identified, have really borne fruit. So we'll continue to monitor, but at the moment I believe everything that needs to be done is being done.
Operator, can you put through the next question, please?
Our next question comes from Jason Herring of the Calgary Herald. Your line is open.
Good afternoon, Dr. Hinshaw. Just wondering if you can comment on this milestone that we've hit today of 1 million COVID-19 tests administered by the province, and whether there are any plans to expand testing capacity in the upcoming weeks.
The milestone that we've hit is a testament to the innovation of our public health lab, to the tireless efforts of our staff and partners such as pharmacists who are taking the samples, the lab processing them. And again, I just want to express my gratitude for all the work that's gone into each and every one of those samples, as well as the follow-up of positive cases through our public health teams, primary care physicians who are assisting with that follow-up. So it is a good opportunity to recognize the work that's gone into that number and really celebrate all of that work and those contributions. With respect to looking ahead, we do know that in the fall, as people tend to come indoors more, perhaps spending more time in closed spaces, with the potential that we could see influenza starting to circulate as we typically do at this time, we are working closely with the lab to make sure that we have the capacity to manage a potential increase in those who have symptoms and to make plans for how to move specimens through as quickly as possible to address the issue I addressed earlier.
Operator, could you put through the next question, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. You said it was bound to happen and the positive case of COVID-19 has been found at a school in Edmonton. So what do you have to say to parents who were worried about this inevitability? And also just jumping off Dylan's question about the long wait times, and I know testing is now available in pharmacies, and you have said that work is being done to reduce those turnaround times, but specifically what else is being done to reduce the backlog?
With respect to the case identified in an Edmonton school, what I would say to parents is that we did know that there would be cases in school, that just like we've identified cases in other workplaces and cases in other settings, we knew that because there's COVID circulating in the community and the school reflects the community, this is something that was going to happen. The public health teams at Alberta Health Services have been working extremely hard to make sure that schools know who they can connect with if they get the first report, and that public health reaches out directly to the school whenever they're aware of a case, so that immediate action can be taken to trace close contacts, make sure that they're aware that they need to stay home, and making sure that all of that follow-up is done to limit the possibility that there could be any further spread in school. So again, this is a part of our plans. This is a part of our response. And with respect to that testing turnaround time, that is a part of the really important foundation of school relaunch, is being able to shrink that turnaround time so that we are able to act more quickly on positive cases. Alberta Health Services has worked very hard to make sure that what previously was a delay from a positive case to contact tracing has now been reduced, and so case notification and contact tracing is now happening extremely quickly, which is a very good sign. In the lab itself, there's work to expand capacity, there's work to streamline administrative processes, such as data entry, getting samples moved into the lab, having the information about the person who the sample came from, having that entered into the data systems in a more efficient way, and other administrative and transportation processes that can speed up that time. So there is a quality improvement team looking specifically at these turnaround times and working very, very hard to make sure that as much as can be done is done. So within the next few weeks, we are able to see that very quick turnaround time coming back again.
All right, I see there's only 2 more in the queue, so we'll take our final 2 questions. Operator, could you put through the next one, please?
The next question comes from Lauren Krugel of the Canadian Press. Your line is open.
Oh, hi there. I had another question related to the drop-in center and the homeless shelter system generally. Just wondering, as winter sets in and the weather gets colder, whether you foresee any changes to your guidance for shelters. I'm hearing concerns that the 1 meter minimum distancing isn't enough to begin with, and that, as demand raises, even that might not be attainable. So just wondering whether you're foreseeing any changes on that front.
I want to be clear about our current guidance, which states that in a shelter context, 2 meters of distancing needs to be maintained between individuals who are moving around, during the day or when there's activity. The 1 meter distance is specifically between sleeping mats, and that 1 meter of distance, again, is when individuals are sleeping for the night, and those who are sleeping, the requirement is that 1 meter be kept, as well as a head to foot sleeping arrangement, so that the distance between the head of one individual and the head of the other is at a diagonal. And it's interesting if you do the math on that. If you look at an average person about 5.5 feet tall, head to foot arrangement with 1 meter of distance is actually almost 2 meters of separation from person to person while sleeping. So what's really important to know in that shelter context is that the distance between mats while sleeping is one component of risk of spread. But what we're seeing in the shelter outbreaks that we experienced a few months ago and the outbreak that we're seeing at the drop-in center right now is the transmission pattern seems to be when people are interacting during the day, when they're outside of the shelter where they might be sharing drinks or sharing cigarettes, and that's actually how we're seeing the transmission patterns show up. If there turn out to be transmission patterns that indicate that 1 meter of distance between sleeping mats is not sufficient, we will absolutely look at that evidence and adjust guidance if needed. And the other thing I should make clear is that when there is an outbreak, at the point where cases are identified, at that point in time, mats must be 2 meters separated. So as soon as there's a single case with that outbreak in the shelter, then we do require that 2 meters of separation for that extra layer of protection and security. And with respect to the number of spaces and what's going to be happening as we move into the fall with colder weather, that's a question that the Community and Social Services Ministry would be best positioned to answer with respect to planning underway for shelter spaces and capacity going into the fall and winter.
All right, we have 2 more questions now in the queue, so those will be our last 2. Operator, could you put through the next one, please?
Our next question comes from Jen Scott of CBC. Your line is open.
Oh, hi, Dr. Hinshaw. I have a question today about notifying schools about test results. We've heard from some parents who have already had children who have been sent home from school because they had symptoms of COVID-19. Principals at the school were saying that they need to hear from AHS that the test has come back negative, that simply screenshotting test results from, say, the online portal isn't good enough. AHS is saying we don't, or is telling these parents, we do not contact schools if tests are negative. What is the protocol around that, and how are schools to be notified that it's okay for a student to come back to class?
With respect to that school exclusion and notification protocol, as Alberta Health Services has indicated, the process typically is that They provide the results back to the person who's been tested, and it is up to that individual then to provide information as appropriate to anyone who may need it. We have not required in our protocols and policies from the ministry to have written documentation or written proof of a negative COVID test. And so that may be a question with respect to either the Ministry of Education or individual school boards about their policies of proof. The expectation from our perspective would be that children who have symptoms would need to go home, and if they do not get tested, they would need to be home for 10 days if these are new symptoms. If they do get tested, the test is negative, but they still are feeling ill, if they still have fever or cough, they would need to stay home until they're feeling well, even if they have a negative test. So it really is only if they're feeling well again and a negative test that they would be able to go back. But again, the question of proof and the burden of proof would be up to that discussion between schools, school boards, or the Ministry of Education. We have not set out a requirement for written proof of a negative test, but rather again, from our perspective, kind of left that to schools to determine what they would require as proof.
Operator, can you put through the final question, please?
Final question is from Nicole Weisberg of CTV Edmonton. Your line is open.
Hi, thanks, Dr. Hinshaw. I was just wondering if you could provide some more details about the case in the school, what school was affected, who and when was found positive, and what advice are you giving to that school now?
The specifics around individual cases we don't discuss because of confidentiality reasons. So I was asked about our public reporting on school cases, and what our current policy is that when there is a case in a school, those who are a part of that school environment, so the staff and the parents, would receive notification as they are the ones who are going to be directly impacted. And if and when a school has an outbreak that has 5 or more cases attached to it, at that point that school would be listed on our public site. But prior to that 5 or more cases in an outbreak, we don't discuss specifics about the individual schools that may have had a case or an exposure at that location, just again because of confidentiality reasons, and that's best managed at that local level.
All right, we have one more question that snuck in. Operator, could you put through our final question, please?
Our last question comes from Natasha Reeby of CBC. Your line is open.
Hey, thanks so much for taking this. Dr. Hinshaw, do you have any advice for parents and neighborhoods that are already starting to think about Halloween? And should we be looking at trying to do this occasion without candy this year?
It's a great question. I actually got an email from a 9-year-old Albertan this week who had some suggestions for me on Halloween, so I know there are people thinking ahead. I know that Halloween is an important occasion for many people, and it's an occasion that really celebrates our ability to be together in a neighborhood. We are looking at this occasion and ways that we might be able to support safe celebrations, but of course it does depend to a great extent on what our numbers, what our case counts, and what our epidemiology looks like at that time. So we are considering this, but of course any decisions about what our guidance might be would be based on what the wave looks like at that time. So the best thing, if you want to have a really enjoyable Halloween, the best thing we can all do is to keep our case counts low, and as we always do, look out for each other and make sure that we're following public health guidance right now, so we set ourselves up for success and the opportunity to have an enjoyable Halloween.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Tuesday afternoon. Have a good long weekend.